Hey friends! My name is Desiree, aka Momma Friendly, and I do all sorts of videos on my channel, from cooking videos to planner videos. I do vlogs, I do hauls, and I also do lots of homeschool videos with a Disney twist, but also from the perspective of a parent of a child that has exceptional needs. My son will be 10 years old this year. He is on the autism spectrum, he has apraxia, and he is nonverbal, along with a few other medical diagnoses, but for the purposes of this video, that's pretty much what you need to know. He's been doing speech therapy for a very long time, and he uses sign to communicate, he uses AAC to communicate, but we still do speech therapy. And recently we started with a new speech center that specifically works with children that are nonverbal, and each of them have their specialty. One of them specializes in AAC communication, and there's another one that specializes in oral motor exercises, if you will. So when it comes to apraxia, that diagnosis typically, and I'm completely just like spitballing here, this is my own version or understanding of what it means. Google is free. If you don't know what apraxia is, you can find the proper definition online. But my understanding of it is that the thought is there, the language recognition is there, but getting the word or words, the sentences from the brain to the mouth, there's something that kind of disconnects or doesn't flow right. And so telling the brain to form the shapes with the mouth, with the tongue, actually the motor planning out what your mouth needs to do in order to get those sounds out, that's where there's kind of a difficulty. So these oral motor exercises are meant to kind of wake the mouth and face up, increase awareness of those muscles, and hopefully help the child or person better manage that process so that hopefully you can start to get sounds that are intentional, maybe even words, maybe even eventually conversation. I've been homeschooling my son his entire life, and I find that most of the things that I've done with him have been things that I've kind of stumbled into, because unfortunately, with as many children as there are right now with these increased needs, I don't see a whole lot of resources being shared for them. So that's the purpose of me making this video. Is if you're someone that suspects apraxia in your child, I hope that you're able to get them to a therapist and get evaluated and come up with a plan of care that's specific to your child. But also, this might be kind of a jumping off point for starting that conversation with your therapist if you already have one, maybe starting a program at home yourself. So we're doing this with the guidance of a speech therapist that specializes in oral motor function. It's not necessary to have a speech therapist, at least as far as the items I'm going to show you today, because they all come with extremely detailed instructions. But it's a good idea to have a professional guiding you so that they can not only set you up with a program that's specifically tailored to your child's needs, but also so that they can help you troubleshoot any issues that might pop up along the way, or show you specifically how to use any particular item for your child's benefit, and so on. That said, I am not a medical professional. Do not take this as medical advice. And also, this video is not sponsored. I don't have any promo codes or anything for you, unfortunately. It's just a parent talking to another parent, letting you know what we're doing, and hopefully maybe starting a thought process in your mind for, will this help my child? Maybe I should pursue it or not. So I've got a very large bag of things that we use daily. And again, this is a regimen that was created for my child by a speech therapist that does oral motor function as her specialty. And she's been seeing my son for a long time, so she's aware of his needs and how to address them because of her specialty. So again, these are just ideas, guys. Do with them what you will. The first step that we always use, the bag's already trashed, is we like to use these sensory bean bags. Everything I'm showing you today is from a website called Talk Tools, which is a website that even speech therapists, professionals use to get their equipment and whatnot. Again, not sponsored. I am not affiliated or associated in any way with the company. It just so happens that that's where I bought my stuff. So if you want to buy exactly this item, this is where you'd go. As you can see, it comes with 4 sets of different little like bean bags. They're called bean bags, but they're actually stuffed, I think, with cotton. None of them feel like they have actual beans in them. I guess they just didn't know what else to call them. And when you open up the little pamphlet inside, it has suggestions for use. I'm pretty sure, again, they call them suggestions because they want you to be under the guidance of a therapist and not necessarily go at this yourself. I don't know if it could necessarily be harmful to your child to go at this yourself. I can't imagine it would be. But again, if you're able, wouldn't it make the most sense to get a program that's tailored specifically to what your kiddo needs? So the way that we use these is my son picks 2 or 3 every morning, and they're all different. This one is just like smooth. This one, as you can see, is silky. This one is fluffy. And this one has kind of a corduroy texture to it, so it's got a little bit of ribbing. It's a little bit rougher. So we take 2 or 3 of them, which they're all different sensations, obviously. And the way that we do them is we start back here and just go along the jawline to the mouth. I'm gonna look a little silly doing these, but I wanted to demonstrate. So we do this 3 times, and then we do it again from the eye, the corner of the eye, down to the corner of the lips 3 times. And then with this bit here, you do it on the upper lip, but towards the lip, downwards. 1, 2, 3, 1, 2, 3. And that's going to start waking up those muscles for the child to start pursing their lips and making that circular motion with their lips, and also waking up the jaw, the TMG. So that's how we always start. The next thing we do, and these are 2 things, the bean bags and this next step are things that we do every single day no matter what. If we have more time, we get into the other stuff, or if I actually have time set aside that day for today we're doing our oral motor exercises, we'll go through the whole regimen. But at the very least, every morning we do these first 2 steps. So we do the bean bags, and then we use this. This is called the Sensi. And you could also use a Z-Vibe. I think that the Z-Vibe is being phased out and the Sensi is what's replacing it, but they're basically the same thing. And again, this comes with a pamphlet, but it's more like a booklet that has super detailed instructions. The set I got is the professional sensory set, so it comes with a lot of different tips. So this is the actual vibe, and these are the tips. Yeah, Sensi Essential Sensory Kit. Right. So the 2 tips that we're using right now, and as he becomes more adept at this, we'll move on to other things. As you can see, it brings a spoon for feeding. It brings like tongue depressor types, all sorts of stuff in here that we're not there yet, so that's okay. We use these 2 tips for right now. This one is got a wavy design and a bumpy design on either side, and this one is just circular all the way around. So we don't have to do this, but my son likes it. I turn it on, so there's a button here and it's got 4 settings. That one pulses, and that one pulses at a like heavier, like deeper frequency. And it's exactly what it is. You could also use Nook brushes for this, or even vibrating toothbrushes. This is meant specifically to vibrate though, so it's going to be a little more intense than say a toothbrush would be. But I like to put this round edge. This is the part that you don't need to do, but I start it and I do again the 1, 2, 3, 1, 2, 3, the same exact thing that we did with the bean bags. What this is actually for is you turn it on with this round tip, and I'm not going to do it on myself because this is my son's, but I basically have him open his mouth and I go 1, 2, from corner to corner, but inside the lip, and then again at the top. 1, 2, I do that 5 times inside the lips. So we're waking up the lips there. And then this square tip with the 2 bumpy sides. This part, goes in his mouth, and you start in the inner cheek. So you're actually swabbing inside the cheek. 1, lift away. 2, lift away. So you're not going up and down on the cheek. You're just going from top to bottom and then top to bottom. So you're not brushing it back upwards. You're just brushing it downwards, if that makes sense. And you do that 5 times on this side, 5 times on this side. We've only just recently started doing the tongue as well, so I have him stick his tongue out. Some kids can't stick their tongue out. You have to build up to that. Like, they don't have the control to be able to tell their tongue, pop out. I need you to pop out right now. My son is there finally. So we also kind of massage the lateral sides of his tongue, so the outside of his tongue, 3, 4, 5 times, whatever, you know, makes sense to him, whatever he likes. And my son, again, every child is different. Some kids are not going to like any of this because they prefer to not have that sort of sensory input. My son really, really enjoys this kind of sensory input. So it's easy for me to say, oh, do this and do that. But if your child is more sensory defensive, having a professional help would definitely be a prudent thing to do. This video might be a little long, and I know that it's not for everyone, but if it is for you, I'm hoping that it's helpful and that you're, I don't know, able to get use out of it so far. You're dropping everything I own. So I kind of want to go in order as far as what we're doing. The next thing that we do every once in a while, or as needed, as we're able, etc., is we like to use these horns. And as you can see, they're labeled because there's a hierarchy. So you're supposed to master 1 before you move on to 2, then master 2 before you move on to 3, and so on. One thing that the therapist did tell me is that for the straws, the horns, everything else, actually everything in the kit, is I should have control of the item the whole time. It's not something that I should just hand to my child, because we want it to remain a therapeutic tool. So mommy's in charge, or the therapist is in charge. It's not a toy. We don't want it to lose its meaning or its effectiveness because he's just running around the house playing with these things. Posture is super important when you're doing the horns, because the whole idea is to control the breath. And so you want him to be able to take deep breaths and release them slowly. Eventually, you end up like breathing out like 4 or 5 seconds at a time. You start out very slowly, like the ones that we're doing right now. He just puts his mouth right here on the tip, and it's meant to be just his mouth, not his teeth. My son has that issue in particular where he uses his teeth on horns, on straws, on everything else to stabilize, because the muscles in his lips are very weak, and what we want is to strengthen those muscles. So you just put your lips right there on the tip and short breaths. The moment that he goes and he starts to struggle, we're done. So the aim is to do 20 a day. Right now we're up to, I think, 12 before he runs out of breath, and that's fine. We'll get there. Once we're able to consistently do 20, then we can move on to horn number 2, which I believe is a harmonica, and we're meant to hold that breath for 2 seconds. So that's why it's a hierarchy, and you need to be able to do one before you move on to the other, because each one becomes more complicated. Maybe that's not the right word, but it's more work, basically. The next thing, speaking of, is our straw kit. So here it is, and again, this is based on a hierarchy, so you have a picture here with all of our different straws. We're already on step 2 with our straws. So again, easiest to most challenging, right? This is straw number 1, and it's just a straight straw. Again, the focus is on not using the teeth to stabilize, but rather just the lip. So they advise that you can start cutting bit by bit here. And in the meantime, like, just have your hand so that he's not, you're basically not allowing any more than his lips to touch, so the teeth can't grab on, little bit by little bit, until you get to the end, and that way he could just do it himself. And then at that point, he could just have this. This is no longer a therapeutic tool. It's not serving that function anymore. So he could just have that. But then step 2 is this curvy one, right? And it has this here. This is called a bite block. So now I don't have to put my hand there. This little disc, which comes off, is serving that purpose. It's making it so that it's a very shallow tip, so he can only put his lips. There's no room for him to wrap his teeth around that. And then he has to pull up the liquid through this more complicated straw. And it goes all the way to like these silly straws and things like that. But they all have their different shapes and their different, you know, making them more and more complicated, more and more work as you move up the hierarchy. So like I said, we're in step 2 there. And that's also meant to help not only promote shaping of the lips, but also the strength of that muscle, because he needs to rely on only his lips rather than using his teeth. The last thing we have meant specifically for the lips and lip shaping are bubbles, believe it or not, which I would think most households with children probably have bubbles somewhere in their house. So I bought the set that brings both the bubbles and the refill. And as you can imagine, the bubbles, it's higher on the hierarchy as far as the challenge, because with the straw he has, even if he's just using his lips and no longer using the teeth to support, he still does have a straw that he can wrap his mouth around, and that's helping him create that circle shape. When you're blowing bubbles, there's nothing there for you to wrap your lips around. You have to just know to purse your lips and blow. Blowing is a huge challenge for people with apraxia, and luckily in the last year perhaps, my son has started kind of just doing it on his own spontaneously, which is huge. So he actually blew his very first bubble completely independently in the last few days, and that was huge. I'm very, very excited, thinking that maybe this year, for his first time ever, he might blow out his own candles on his birthday cake for his 10th birthday. And that's just incredible. If you know, you know. But with the bubbles, again, we're practicing. I have notes here, which is why I keep looking down. But it is about lip shaping. It is about lip rounding. And then it's also something that you can use for breath work, because one of the things that we do is we blow a bubble and catch it. This is mommy's job. But then my son's job is to go and just notice how when he breathes on it, it moves. So he can see the effect of his breath. He can see, just get that visual cue of this is you breathing. This is you doing it. You like telling your mouth to form the, and something is coming of it, right? Because you can't see breath, you can't see the blowing, but this gives you a perfect indication, a visual indication of you're definitely doing something. And once you've done that successfully, then the next step is, okay, well, now that you know how to breathe, you know how to blow, and you know that your blowing causes a change in the bubbles, now the next step is making your own bubble, which I couldn't do just then, right? So different steps. Like I said, everything is a hierarchy. It's all about baby steps. It's all about making it a challenge, because it will be a challenge, but also not making it so challenging that it's not fun, because if it's not fun, then your child's not going to want to do it, and who can blame them, right? So moving on now, we have 2 more things. Again, I know this video is long. I'm sorry. I'm trying to pack a lot of information into one place. So we have here a bunch of bite tubes, also known as chewy tubes. My son basically lives with chewies in his mouth all the time, because like I said, he really enjoys that input. But these in particular don't look like the ones he uses, and that's on purpose, because I want him to know when these come out, these are not for you to walk around the house chewing on. These are your work chewies. Again, we're trying to make sure to separate a toy or an everyday item from a therapeutic tool. These are your therapeutic tools. These are not meant to just play around with. There's a job that we're supposed to perform with these. So the very easiest one is the red one. And then the next one in the hierarchy, because of course there's a hierarchy, is the yellow one. And they're very similar, but you'll notice that the red one is wider. It's larger, whereas the yellow one is smaller and more narrow. And the reason that this is more challenging, even though it's smaller, is because these are meant to help with the up and down motion of the jaw. It's about jaw control, it's about jaw strength. So the way that this works, and again, I'm not going to put this in my mouth because they're my son's, but you would just put it straight back on the molars, so a straight line back. Let this reach all the way to the back of the teeth. And if you have to guide your child's mouth up and down, that's fine until they get the hang of it, but the idea is you just want to straight up and down, up and down, up and down. And she told us that if we could get up to 10, 15, that's great. The thing is that there should be no sliding, which my son does a lot. So again, up and down, but if you see that the bottom, the jaw starts to actually wiggle around, that's when you know the jaw is tired and you need to stop. Unless you've just started, in which case you might want to stabilize a little more, hold their face a little more, help them with that up and down motion. But sliding, you don't want them to get into that habit because that's the opposite of what you want. And again, once he's mastered this larger one, then you move on to the smaller one, because since it's smaller, it's a bigger chomp that you have to do all the way down to it. And it's smaller, so it's easier for it to slide around in your mouth. So he has to have enough control to keep it just up and down and in place rather than letting it wiggle around the way that it wants to. Same token, you have this one, which is a little larger than both the red and the yellow. And then this last one on the hierarchy, this one is the same shape as the purple, but it's firmer than the purple. So this is the same notion though. You start, boom, back here, chew, 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 chomp, chomp, chomp. When you do as many as you're meant to, you could just flip it over, go to the other side, chew, 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 chomp, chomp, chomp. It's just a style thing. You don't have to change it. Like, you know, it's not like one side is meant for the other or what. It's just, that's what it looks like. So that's what we do. And like I said, this is the same thing, it's just firmer. So that's the hierarchy for that. And again, that's for both jaw strength and jaw control. And the very last thing, which we haven't really gotten into yet because I don't think we're ready, honestly, just yet. These are called bite blocks, and it comes in a set of 2 so that you can use one on each side of the mouth at the same time. So the chewy tubes, we're just doing 1, 1, 1, 1, 1, and then 1, 1, 1, 1, 1. This is meant to be like, take the 2 matching ones and put them both in the mouth at the same time. There's different jaw heights to make different speech sounds. So for example, actually they're numbered, they don't have the sounds on them. I guess you're just supposed to know that, or you could read the very detailed pamphlet that they came with. This one comes with a book, basically, that you can read. Actually, this is extremely informative because it tells you all the different exercises you could do. It gives you the criteria for, okay, now this looks correct, now you can move on, and so on, how long you should do it, etc., etc. So yeah, this is very informative. But basically, these larger ones, you're gonna need a different bite and a different shape to your mouth than these smaller ones. The smaller ones are going to be the hardest ones because you have to, again, bite all the way down basically. And I know that our therapist said that, for example, this is like the S sound. These very thin ones, you don't need to open your mouth very big to do an S, so this is where you'd practice. And the reason I say that we're not quite ready for this yet, I don't think, is because how we did the chewy tubes, it was just up and down, up and down, up and down, over and over. But this, you're meant to actually just clamp down on it, and then I would slowly pull it out while he's doing his best to just hold on to it. Hence, bite block. It's not meant to chew, it's meant to bite, to clamp down. So you really have to have some jaw strength to be able to hold this in place with just the strength of your jaw while somebody's pulling it out. And I'm not saying be a savage, be an animal, and rip it out of your kid's mouth. That's not how that works. That's not the therapeutic way to do it. This is one of those things where it's like, obviously you need guidance so you don't do the wrong thing and potentially hurt your child. There's a correct way of doing that. But there's a few different things that you can do with these bite blocks. They're for jaw stability specifically. And you also do it at the front of the mouth so he could clamp down, well, clamp down like this. And then again, I would kind of try to drag it out, but I don't think that he has the jaw strength yet. There's a big load of power in the word yet. I don't think he's there yet. So we're not using these right now. But we have plenty to do, right? There's plenty of other steps so far that we've been able to get through. And that's pretty much it. That's everything in my haul, so to speak, of my talk tools. That's our regimen for our oral motor exercises for apraxia. If you or your kiddo or anyone you know also have this condition and are doing something similar, I'd love to hear your experience. I'd love to know if you're using these items in a different way maybe, or if you're using other items altogether. Let me know all about that in the comments. The sharing of information is super important in this community, and I'd love to hear from each and every one of you. I want to thank you so much for watching this video. I really hope you enjoyed it. I really hope it was informative. If you did like it, I hope you'll please give it a big thumbs up. I'd also love it if you would subscribe and click that notification bell, because I post at least 3 times a week. I do homeschool videos all the time with a Disney twist even, so they're super fun, and I wouldn't want you to miss a minute. Thanks so much again for watching. Bye!